Men, low testosterone could be causing depression and anxiety. Today I'm with Keith Bishop, our clinical nutritionist, and we want to talk to you about how we can customize hormone therapy or some natural options that may help with your low testosterone. Well, I'm here with Keith Bishop, our clinical nutritionist, and Keith, we hear a lot on the radio or on the TV about low T and how you need to get your levels checked.
Right.
And a lot of times they spin it to boost energy, to boost libido. But could it be tied to depression and anxiety as well?
Definitely. So I've seen this in many different health studies. Actually, there's medical studies showing in men where they give them testosterone if they've had a history of depression or a history of anxiety. Supplementing that natural hormone definitely can help out with those symptoms. Now, it depends on the person, so we have to be careful. I've also seen my clients that they start their testosterone and they actually start getting more aggressive, argumentative, and so we do have to be careful.
Right. Okay, so how can testosterone be tested?
Well, typically testosterone can be tested either through a healthcare practitioner with a blood test or with a saliva test. We do that here at Flourish. Saliva test, a take-home test kit, spit into a test tube, send it off to the lab. We get the results back, and we can do more than just that. We can also test even the estrogen, progesterone, testosterone, and stress chemicals too. Yeah. So we do a lot of things. It's not very expensive.
Okay. So that kind of goes through the testing, but how could just depression and anxiety be evaluated or checked out?
Right. And so, actually with hormones or anxiety and depression, I like to use symptoms lists and testing. So the hormones, we can test for that. We can look at those symptoms because everybody's different. So testosterone, may be low in one guy, but he doesn't have any problems at all with anything. Right. Okay. So we have to look at symptoms too. Everybody's different. And then for neurotransmitters, the same thing. We're going to look at a list of what these symptoms are, the different neurotransmitters, and then we can test also for that. Another take-home test kit, urine sample. Actually, in this case, send it off to the lab. We get the results back. So combination, testing and symptoms evaluation. Okay.
So let's say we get the test back. You do see that you're low in testosterone. What are some options moving forward from there?
Well, they can include whether it be a customized prescription product, which is our specialty, that we do at Flourish. Customized prescriptions. We have natural supplements that can help out with testosterone and depression and anxiety. So there's several different options.
Okay. And so if you do go forward with these treatment routes, about how long does it take to see an effect from that?
So, these are not an immediate result. It can take up to 2 weeks to see, kind of an effect, but then actually about 2 months to see the final effect, good or bad, and or making adjustments.
Okay. Well, great. Well, men, if you think you might have low testosterone, come see us today. We'd love to talk with you about these testing kits, about some other options. Another option, like Keith mentioned already, is we do customized hormone therapies for men and women. We work with your healthcare provider to make that happen. Also, as Keith mentioned, we have some products here available to help you get that testosterone level up, and we can help you track that. This is just another way of how Flourish can help you feel better faster.